Okay. Welcome back to N-Powerment Nursing. I'm Linda, and you've joined me for our weekly test question where we apply our Facebook Live on prioritization. If you didn't see that Facebook Live, please check it out on our Facebook page. So here's the prioritization question. A 28-year-old woman with a history of depression is 8 weeks postpartum and has come to the clinic today to have her baby immunized. When asked how she's managing, she tells the healthcare provider that she is crying every day and has feelings of hurting the baby. What would be the priority nursing action? Okay, well, before we get into any of these options, going back to the stem of that question and looking and seeing, okay, she's 8 weeks postpartum. 8 weeks postpartum and having these sad feelings where she's crying, that is unusual. That is well past any kind of postpartum baby blues that happens kind of day 5 and subsides day 10. What else can we look at the stem of the question? Okay, let's zero in on feelings of hurting the baby. Okay, that's serious. So even before we get into the options, we know 2 things: that this is not just postpartum kind of baby blues, and that this woman is in serious trouble of either hurting herself or her child. Okay, so here are the options. Number 1, ignore her comments and proceed to immunize her infant. Well, that is, kind of goofy, because that is not falling in line with our therapeutic communication that we did a Facebook Live on. Check it out on our Facebook page. Do not allow her to leave the clinic until she is assessed further. That is the correct answer. I'll come back to that. Tell her of community resources in her neighborhood where she can meet other new moms. Again, you would not do this. It is ignoring what she's saying to you. You're not using therapeutic communication. And finally, advise her that baby blues are common and assure her they will pass. Okay, well, that's just false. That's not a true statement at all. So let's go back to the correct answer, which is number 2. Do not allow her to leave the clinic until she is assessed further. Well, this is the nursing process, assessment. This is an emergency situation, right? We want her to be assessed further, but it's an emergency situation where she could leave your clinic and she could kill herself or her baby. So you're not going to let her go. She probably is going to be formed and hospitalized immediately. And so you're going to intervene here before you assess further. You're going to intervene by not letting her leave, and then there's going to be further assessment, because this is one of those situations where you have to take action immediately. It also falls in line with Maslow's hierarchy of needs. If you think about safety and security, right? You're keeping this woman and her baby safe. And so the correct answer here is number 2, do not allow her to leave the clinic until she is assessed further. For this answer, the answer to this question and more, check out our complete study package where we have a section on prioritization. Thanks for joining me.